Hey guys, this is Dr. Ben. Wanted to talk to you a little bit more about sprain and strain injuries. We talked briefly about it last week when we were talking about some of the stretch and flex and some things you can do to warm up in the morning. But probably one of the most common injuries in the work that we do in heavy, type of construction is with the low back. All right, so the lower part of your spine. And I wanted to give you some more specific tips regarding that, and then some ideas or suggestions about how to take care of that, even if you do have some injuries. Again, ultimately you're the decider of how you want to deal with those injuries or manage those injuries. We all have different pain tolerances. We all have different methods and approaches to taking care of that. But I do want to give you some suggestions on that. So this is your low back, right? This is your hip. You're supposed to have this nice curve in your low back. That's why a lot of us, when we're sitting down, we have a lumbar support in our back. So if you're a heavy equipment operator or in a piece of equipment, it's always important to have that arch in your back. The spine is actually 16 times stronger when it has a proper curve in its spine. Okay, and then again, from the front to back view, you want it to be straight up and down. That's one of the reasons why, like in our office, for example, we take x-rays on many people to make sure that that alignment is there. Because if they have a misalignment, it might not feel any pain yet, but then they go to lift up some heavy object or do some work, and then all of a sudden it's kind of the straw that breaks the camel's back. And so that's why preventative maintenance, preventative wellness is such a big idea, because if we at least keep these moving and keep them properly aligned, then your chances of having an injury are much, much lower. All right, so that's a really important concept. That's why the clinic is available to you and your families to help avoid that. All right, now that being said, and then again, the stretches. So in the morning or anytime during the day, stretching that spine, moving it back and forward, the toe touches. Generally, when you're doing a stretch, you want to hold it 5 to 7 seconds. Kind of avoid bouncing. Okay, some people when they're stretching, they reach their toes and they just bounce up and down. You want to do more of a slow, sustained stretch, okay? And then just rotating like this and then sliding your arms down your legs. Okay, that's a really important thing to consider. All right, and then like I talked about, moving into the heat of the summer, it's important to stay well hydrated, and it's important to stay to getting good rest. The problem with when you're not hydrated is these discs in your spine right here, these are made up mostly of water. And so when they're dehydrated, like when you're thirsty, if you will, your spine is also dehydrated. And then that makes you more prone to injury. Now, if you are injured, okay, so let's say you go down, you feel something go, and you got pain in your back or pain in your muscles. Again, I can't tell you what to do and again, how to treat that for yourself, but I would encourage you to be careful about trying to mask that or medicate that with a drug, okay, and a pharmaceutical drug even. Because as we do that, what happens is, let's say that you have a problem, but now you're taking the medication so you don't feel it. Now what you might go do something that you wouldn't have done if you could feel it. And because of that, you can make the injury even worse. So maybe you strain the muscle, and that's you should be, being careful. Instead, you take some pills, covers it up, you go lift something you shouldn't, and now you blow out a disc, right? And now instead of having just a sore muscles in your back, you've got something that could end up requiring a surgery. Could be career-ending for you. Okay, so that's why I'm not opposed to, in a sense, to drugs. It's not really my job. My job is to make sure that people are managing those things appropriately and not setting themselves up for even a more serious injury. Oftentimes with injuries like that, just by stretching, adjustments, icing, things like that, that's how you get your best results. And in a day or two, things will generally clear up as long as it's not too complicated. If there's a new injury, one of the best things you can do is actually apply ice. Okay, and what you want to do is ice the area, keep a towel or a t-shirt between you and your injury. You want to ice for about 10 to 15 minutes, okay, and then you want to take a break for about an hour. Okay, you don't want to just put an ice pack on there for 2 hours. You can actually cause it to be more of a problem. You want to put the ice on that area of inflammation. It will help reduce that swelling. Okay, and that can be more helpful than many times than any sort of drug. And then also, if there's pain there, you're able to still feel that, and it will help you not make that injury any worse. There are also some natural things you can do, some natural supplements that you can take. Turmeric is one of them. You've probably seen that or heard. It's an anti-inflammatory. It works better than some of the steroid medications that people take, and it's natural and it won't cause you any side effects or any problems, and it doesn't mask pain. One of the other ones is omega-3s. That's fish oils. You hear about those as well. Those also help reduce inflammation, and they're just good for your health in general. So guys, it's kind of like this. We want to do everything we can to avoid the problem to start with, right? We want to be stretching, we want to be hydrated, we want to be taking care of ourselves, we want to be having our spines aligned, we want to be maintaining it. Absolutely. Then heaven forbid if there is an injury, again, we want to manage that as conservatively as we can, right? We don't want to be just piling a mouthful of pills down, not feeling anything, and then going down and putting ourselves or others at risk. Okay? And again, can't tell you how to manage that, but just want to encourage you to manage your health conservatively, right? Safely, so you can, of course, work hard and have a long, healthy career in construction, but then also prevent things from getting worse or having even a more serious injury down the road. So hopefully that was helpful to you guys. If you haven't been to the clinic yet and you want to have that evaluation done to see if there's any areas of concern and we can help you, let us know, call the clinic, email the clinic, text the clinic, and we'll get you in. If not, have a great day and take care, guys. Bye-bye.